I have a friend actually told them that I was going to be doing this podcast with you, and they were like, "Oh, I've got a question for you."
Yes, tell me.
So that is, what is and what causes ocular migraines?
I think this is a very interesting and fascinating question. And there's a lot of terms for ocular migraine: visual migraine, retinal migraine. Typically what happens is this: a patient starts to see something in their vision. So your typical patient will come and say, "Doc, I'm seeing something in my vision. Let me explain it to you. You tell me if I'm going crazy." They're looking at anything. You're looking at the TV, they're looking outside, and they see something in their vision that almost looks like an after image. You know, you look at a bright light and then you look away and you still see that image there. But you know it's not real. You know it's just an after image from that bright light. But a patient will start to see that after image without looking at a bright light. And then it'll get a little bit larger, and then a little bit larger. And suddenly it's blocking their vision. I'd go to look at your face and I can't see anything besides that image. And it's scary. And then you cover one eye and it's in that eye, and you cover the other eye and it's still in that eye. That image, that after image, or that aura moves and expands out. And everyone's is a little bit different, but it usually ends up in a C shape or an inverse C shape. And it usually has some zigzags or squiggles to it. And so instead of a perfect curved C, it's a squiggly C. That will remain in their vision for anywhere between 5 and, say, 30 minutes. Every patient, again, is a little bit different. But it's annoying, I'd imagine. Whenever you go to look at something, I go to look at your face and you're just kind of like haloed by this zigzag aura. The first time it happens to someone, it can be very scary, and they'll come like as an urgent complaint or a walk-in, or they'll call, and we'll talk them through it. But that's an ocular migraine, and there's lots of terms for it. And typically when I say the word migraine, you think of this massive headache, right?
Right.
And a couple of things about that, but sometimes this aura, this ocular migraine, can be what precedes a regular painful headache type of migraine. And the patient will start to see this aura, this image, this zigzaggy C in their vision, and think to themselves, "Oh no, I know what's coming. You know, in about an hour, I'm going to start to have a headache. I'm going to start to have a migraine." And they can use that visual clue or cue as a timer, right? I have to get to someplace. I have to get to my house. I have to close the door, go in a dark room. I have to be safe because I know that when this aura is over, then I'm going to start to get my headache. And everyone's migraine symptoms are a little bit different. But a lot of times, patients will get this ocular migraine and won't have a headache following it. In fact, the majority of the times, patients just get an ocular migraine. We'll do an eye exam on them, and everything is fine. There's nothing wrong with the eyes when you're having an ocular migraine. The electrical sensation that's happening is happening in your brain. And whenever you get a migraine, it's in your brain. There's always electrical waves going over the surface of our brain, right, and inside our brain. And when you're having a migraine, some of those are disrupted or changed. And that's hence why people can cause a headache. But when it happens in the occipital lobe, in the very back of the brain, it causes this phenomenon in your vision, right? And it's over top of your vision. I can still see your face when I look at your face if I'm having an ocular migraine, but it's just I see this image in front of your face. And the real number one way that you can diagnose that this person's having an ocular migraine versus a retinal detachment or macular degeneration or any other kind of diagnosis is you ask them to see if it's in one eye or both eyes. And so if you're having a flash of light or a symptom of that you think maybe is an ocular migraine, close one eye. Can you see it in your right eye? Yes. Now close your right eye and open your left eye. Can you see it in your left eye? Yes. Well, then it's probably something in the brain. It's probably an ocular migraine, right? Because what are the odds that you'd have a retinal detachment in the exact same spot in both eyes at the same time?
It's probably easier to hit the mass lottery than it is to...
Exactly. So, I'm sure everyone would panic a little bit when this happens to their eyes. or to their vision. But do yourself a favor and do your doctor a favor and cover one eye and then cover the other eye and see if you can see it in both eyes. And then close your eyes and see if you can see it through your closed eyes. And often with ocular migraines, you can, because the electrical impulses are happening in your brain and it's sending that information to your eyes, but it's not in your vision. It's not in your visual field.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.